Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How the ADHD brain is wired differently. The brain of a person with attention deficit hyperactivity disorder, ADHD, is different from the brain of someone who is neurotypical. These differences can lead to symptoms such as limited attention, excitability, impulsivity, difficulty focusing, aggressiveness, and other potentially disruptive behaviors, but they can be managed. /r/n/r/n The differences in the structure, function, and chemistry of the ADHD brain reflect neurodivergence rather than flaws. Insights on brain function have given scientists the means to develop drugs and therapies that address these atypical functions and the behaviors they cause. /r/n/r/n This article explains the differences between the ADHD brain and the neurotypical brain. It also describes what is involved in the diagnosis and treatment of one of the most common neurodevelopment disorders in children. /r/n/r/n ADHD is a complex disorder associated with detectable differences in the structure of the brain. /r/n/r/n In general, parts of the brain in children with ADHD tend to be smaller in volume compared to children without ADHD. While this has no impact on a person's intelligence as it's unaffected by ADHD, it does suggest that certain variations in the amygdala, hippocampus, and other structures may account for the symptoms of ADHD. /r/n/r/n By adulthood, these variations become less notable. This may also account for why the rate of ADHD in adults is only a fraction of what it is in children. /r/n/r/n Among the key differences seen in the brains of children with ADHD, /r/n/r/n brain regions don't operate in isolation. This means that dysfunction in one part of the brain may result in dysfunction in others. /r/n/r/n For example, the basal ganglia of children with ADHD tend to have greater interaction of nerve signals, known as functional connectivity, than children without. While increased connectivity may sound like a positive thing, it is associated with a decrease in the diversity of interactions. /r/n/r/n So while certain brain processes may move faster, others may fall to the wayside. In children with ADHD, this results in increased hyperactivity and decreased executive functioning. /r/n/r/n Decreased blood flow to the prefrontal cortex has also been seen in the ADHD brain. This is referred to as hypofrontality, a condition linked not only to ADHD but also to mental illnesses like bipolar disorder and schizophrenia. /r/n/r/n However, unlike those illnesses, the functioning and structure of the ADHD brain can start to become more typical as a person ages. This may explain why childhood ADHD doesn't always follow you into adulthood or may not be anywhere near as severe. /r/n/r/n Different neurotransmitter activity has also been seen in the ADHD brain. Neurotransmitters are chemical messengers that deliver see instructions to different parts of the brain. /r/n/r/n There are two neurotransmitters associated with the ADHD brain. /r/n/r/n Dopamine levels are characteristically low in people with ADHD, which may cause them to compulsively seek high dopamine activities to activate the reward center of the brain. /r/n/r/n Norepinephrine levels also tend to be low, leading to a reduced ability to self-regulate and maintain focus. /r/n/r/n ADHD is diagnosed based on a set of criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. To be diagnosed with ADHD, you must exhibit certain behaviors, broadly defined as inattentiveness, impulsiveness, and hyperactivity, to meet the diagnostic criteria. /r/n/r/n Currently, brain imaging is not used in the diagnosis of ADHD as the tests have not proven reliable in telling whether you have ADHD or not. /r/n/r/n. With that said, imaging tests may be ordered to determine if there are underlying issues related to ADHD that need further investigation. This includes risk factors for ADHD such as /r/n/r/n. In clinical practice, the following brain scans may be used for specific purposes. /r/n/r/NAD is frequently misdiagnosed in girls due to gender bias and the way that ADHD manifests in girls. While boys with ADHD tend to experience hyperactivity and impulsivity, girls generally display inattentiveness and distraction. /r/n/r/n. Because many clinicians associate ADHD with disruptive behaviors, they may overlook less disruptive symptoms in girls and diagnose and treat them for anxiety or depression. /r/n/r/n. There is no cure for ADHD, but it can be managed with the right treatment. The treatment can differ for children and adults but may include /r/n/r/n. Keep in mind that ADHD is considered an expression of neurodivergence. The atypical brains of people diagnosed with ADHD reflect some of the possible variations in human thinking and human behavior. /r/n/r/n. Brain differences have been noted in people with ADHD versus people without ADHD. These include differences in the size of the brain, especially in children, the function of the brain, including blood flow to the brain and nerve connectivity, and levels of neurotransmitters that regulate motivation, behaviors, and attention. /r/n/r/n. These changes in the brain are not diagnostic of ADHD. Even so, different brain scans may be used to check for conditions associated with ADHD, such as brain trauma and lead toxicity. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.